Project Illinois, we continue our investigation tonight into the Department of Children and Family Services.
We started this deep dive into the state agency after the tragic death of 2-year-old Tanisha Barnes. Since then, we've covered the deaths of hundreds of children with connections to DCFS. Now tonight, we are looking at the facilities called Interim Care Centers. And
this comes after the man appointed to protect the interest of thousands of kids in DCFS custody is calling out a DCFS private agency. The public guardian Charles Goldberg told a Chicago court that Aunt Martha's is violating civil and human rights of children in their care.
News Channel 20's Anna Espinosa has been investigating this for months. What did you find out, Anna?
Well, Stacy, John, I sat down with both Goldberg and Aunt Martha's officials, and while both agree that the children they're serving are the most vulnerable and should be cared for, they disagree on how to do that.
It's something DCFS manufactured and pulled out of the air.
Charles Goldberg is the Cook County Public Guardian for close to 6,000 children in DCFS custody. His job is to make sure those kids are being taken care of, something he says DCFS isn't doing.
It's just most unfortunate that DCFS has gone down this path.
He's talking about Interim Care Centers.
For someone who doesn't understand Interim Care Centers, actually no one understands what they are because there's no such thing.
Aunt Martha's, frankly, might be ahead of the curve with regard to the services that we provide.
Ricardo Meza is Aunt Martha's Chief Strategy Officer and General Counsel. One of the programs he oversees is the Interim Care Center. According to DCFS, an ICC is a short-term living arrangement for children coming out of psychiatric hospitalization.
It is a physician-led approach to coordinate treatment and care plans for the youth, and then we coordinate with them to figure out where should their next placement be.
But Goldberg claims there is no evidence to prove ICCs are a good placement for children.
If you scour the social science literature looking for references to interim care centers, if you scour social work literature, if you scour other models in other parts of the country, you will not find anything called an interim care center.
Although the ICC contract was just signed in February, Aunt Martha's Chief Operating Officer Audrey Pennington said they've been doing this integrated care for more than a year and have seen results.
We've seen about a 30% reduction in hospitalizations, compliance with medications, success with a reduction in acts of physical aggression, and then we've seen them transition on to more permanent placements.
The Interim Care Center is even being debated in a court case between the American Civil Liberties Union and DCFS. We got a copy of the transcripts. During the last hearing, an attorney with the ACLU said this isn't a known treatment for people coming out of psychiatric hospitalization. This is a made-up thing, and it was operating as a shelter. I asked Meza what he thought about this.
Those comments were made by Ms. Dallenberg at the end of the hearing. I think you'd have to ask her what she meant by it. I'm not sure.
I know, but as someone that's operating this ICC, what are your thoughts when you hear someone say that this is a made-up thing?
I would say that, like I said, HFS is moving to an integrated health home model. I think integrated care is well known throughout the nation, and it is a successful model.
Goldberg is asking the judge overseeing the court case to stop DCFS from continuing the Interim Care Center. He's written 4 different letters. The next court date is set for July 30th. And coming up tomorrow,
there's not a whole lot that says to a kid, you don't care more than being forced to stay in a psychiatric hospital for weeks and months after you're ready to go.
A problem the public guardian says has gotten worse in the last 5 years. Kids staying in hospitals longer than medically necessary. That's coming up tomorrow at 6 p.m.
Very eye-opening. Thank you, Anna. Don't forget, we want to hear your story with DCFS. Call the number on your screen or email us at tips@newschannel20.com.